Okay, so here in this session we will discuss about atrial enlargement. Okay, atrial enlargement, chamber enlargement. All right. So this is your normal PUF, what we see in lead 2 and V1. So normal PUF is like this. All right, you know that. But in see, if we divide it like this one, let me take a different color. This portion. Okay, this portion of the PUF and this portion of the PUF. Okay, so we're dividing PUF into two portions. This portion is usually for right atrium and this portion is usually for left atrium. Are you getting the point? PUF is mainly for atrial depolarization. Now if we break the PUF, this portion and this portion, the upward and the downward slope. So upward slope is for right atrium and downward slope is for left atrium contraction. Okay, so definitely there are few changes that we will see in case of right atrial enlargement, in case of left atrial enlargement. Say the PUF is like this is your PUF, right? I mentioned this is your right atrium and this being your left atrium, right? As a result of the contractions, this part right atrial contraction, this part left atrial contraction of the wave, right? So say there is a enlargement of the right atrium. Now there is a abnormality in the right atrium. So what will happen in case of right atrial abnormality? So see, now the right atrium, there is abnormality and the right atrium cannot, you can say the right atrium cannot contract properly. So first what will be there will be rise, but when there is a right atrial abnormality, okay, so there will be abnormality in this segment. All right, so it will become tall. All right, left is okay, but this will become tall. See this one. And if we talk about the left atrial enlargement, so the right atrium will contract well and good. All right, but when it comes about left atrial contraction, there will be a sloping pattern, M-shaped. All right, now I think you are clear that when there is an abnormality or problem in the right atrium, the right atrial contraction will be for the right atrial contraction, the ECG tracings will go little upwards. All right, when there is a problem in the left atrium, the right atrial contraction is okay, but for the left atrium, it will, while it will try to come down, or when the ECG curve will try to descend, there will be abnormality, so it will go again upwards and then come downwards. It will give a M pattern. I hope I am able to make you understand. So see this one. There is, it is a case of right atrial enlargement. There is an increase in the duration. Okay, and see this one is your left atrial enlargement. Now the ECG wave is going upwards, but when it is trying to come down, since there is a left atrial enlargement, there is again upward slope and then coming down, right? This is the M pattern. So in right atrial enlargement, you will be getting a peaked PUF, which is known as the P pulmonale, a peaked PUF, right? And with amplitude, which is more than 2.5 mm in the inferior leads, that is 2-3 ABF, and more than 1.5 mm in B1, B2. So these two leads, you are so significant changes. All right, and the principal cause being your the principal cause I will write in a different slide. Okay, so these are the changes. Okay, and in case of left atrial enlargement, there is a broad bifid PUF, M-shaped PUF, you can see, and you know, these are the changes of the right atrial and left atrial enlargement. That's how you can differentiate. So what I mentioned is that in case of right atrial enlargement, there will be an increase in amplitude of the PUF. In case of left atrial enlargement, there will be a M-shaped or bifid shape of PUF, right? Now let's go to the causes of the right atrial enlargement and left atrial enlargement. So this I am writing right atrial enlargement, I am writing left atrial enlargement, and there I am writing the causes. So what are the causes? Very important, and remember that first cause of your right atrial enlargement is your cor pulmonale, chronic lung disease, tricuspid stenosis, congenital heart disease, pulmonary stenosis, phenocetology, primary pulmonary hypertension. So all are causes of your pulmonary hypertension, right? All are the causes of right atrial enlargement, whereas the causes of your left atrial enlargement is mainly seen with mitral stenosis, since mitral valve is in the left side of the heart. So in mitral stenosis, you can see left atrial enlargement. Don't forget these points, right? So also I will Again, I would like to say that in right atrial enlargement, there is increase in the amplitude of the P wave, which is known as the P pulmonally, and in case of left atrial enlargement, there is broad bifid P waves in lead 2, which is known as the P mitrally. Okay, is M shaped, right? Okay.